Good morning, everyone. In this section, we will be talking about limbic system anatomy. So, to know about the limbic system anatomy, we'll divide into various components. The gross anatomy of limbic system, which we'll see first, followed by the MRI anatomy of limbic system. Coming to the gross anatomy of limbic system, there are three components. There is a limbic lobe, there's a subcortical component, there are other components which are clubbed together. The limbic lobe, this I have taken from this reference. The limbic lobe basically has seven cortical elements in it. The most important is the cingulate gyrus, which is just above the corpus callosum. This is a corpus callosum. So just about what we are able to see is the cingulate gyrus. And as it turns inferiorly and anteriorly, just antero-inferior to the mammillary body and the corpus callosum, this part is called as the subcallosal gyrus. The cingulate gyrus deals with nociception. The subcallosal gyrus deals with depression. And as you move more inferiorly, so this is the cingulate gyrus, subcallosal gyrus. More antero-inferiorly, what we get is the orbitofrontal cortex. This plays an important part in smell-related memories. Insular cortex deals with addiction, craving, and desire in human beings. Insular cortex is commonly seen as the first element that gets involved in case of a middle cerebral artery stroke. Moving on, we also have the hippocampus. Hippocampus is just anterior to the temporal horn. It's in the anterior part of the temporal lobe. The green color thing is the hippocampus. Hippocampus plays an important role in long-term memory. It is also called as a cornuous ammonus. Cornu basically means horn. Ammonus basically means a sheep or goat. The next component of it is the uncus. Uncus, we'll see the details of uncus later actually. The most medial and anterior-most part of the temporal lobe is called as the uncus. This is something that we commonly report as the uncal herniation in case of CT and MRI. This deals with nociception. Last and most important thing is the hippocampal gyrus, which also plays an important role in communication. So what exactly happens is, we'll zoom this image. This red color line which we are able to see, that is the collateral sulcus. This collateral sulcus divides the occipitotemporal lobe into two components. The pink color thing which is called as the fusiform gyrus, which is more lateral, and medial to the collateral sulcus what we see is the parahippocampal gyrus, which is part of the limbic system. As you move posteriorly, the parahippocampal gyrus becomes the lingual lobe. So this is the lingual lobe, this is the parahippocampal gyrus, this is the fusiform gyrus. The fusiform gyrus and the parahippocampal gyrus and lingual gyrus are separated from each other by the collateral sulcus. So these are the seven components of the limbic lobe segment of the limbic system. Moving on. Next we have the subcortical component. Subcortical component basically has five components in it. The thalamus, the hypothalamus, amygdala, olfactory bulb, and septal nuclei. Amygdala is the center of the uncus. Amygdala and the uncus, if you see, this entire part would be the uncus. The center part of the amygdala, it is considered to be the home of the uncus. That is amygdala, which deals with fear and anxiety. And olfactory bulb. Olfactory bulb deals with smell emotions. So this is a cribriform plate of ethmoid from which we see lots of small nerves which are basically the olfactory nerves. And the olfactory nerves end in the olfactory bulb, which is a component of the limbic system. Septal nuclei, how do you identify in gross anatomy? We look for the septum pellucidum, and as it ends inferiorly, we see the septal nuclei. Septal nuclei plays a vital part in pleasure in human beings. So that is the second part of the limbic system, which is basically the subcortical component. Then there are other components. We'll go one by one actually. So we earlier saw the hippocampus, which was this green color structure. From the hippocampus, what we see going outside is the fimbriae of the hippocampus, which ends in the fornix. So here we are able to see this is a fornix, which goes and ends in the mammillary body. Okay, so fimbriae of hippocampus and fornix. All the three structures are closely related. This is the mid-sagittal section of the brain. Here there are lots of things which are going on. We'll try seeing each and everything. So there is a W kind of a structure which is seen in the anteroinferior aspect of the hypothalamus, which is the anterior commissure, the linea terminalis, the optic chiasma. Then we have the median eminence, the pituitary stalk, pituitary gland. This is the mammillary body, and posteriorly what we are able to see. This structure, this is the tuber cinereum. This is also another important structure which is between the pituitary gland and the mammillary body. This tuber cinereum, this is an important structure because there are like a couple of things which are specific here. One is the osteolipoma, which can occur here. The second thing is the hamartoma, hypothalamic hamartoma, which is known to occur in this particular location. So the anatomy is very important because certain diseases or disease pathologies are known to occur at certain locations in the brain. So this is a tuber cinereum which ends within the mammillary body. So as we go above, this is a W which we saw anteriorly. As we go posteriorly, what we see is a germinating kind of appearance. This is a seed which germinates into two leaves. So similar kind of an appearance is seen, where this looks like the pineal body. There are two leaves which is coming out of it. The inferior leaf is the posterior commissure. The superior leaf is the habenular commissure. Okay, so this is the pineal body, habenular commissure, and the posterior commissure. This is just above the level of the superior and inferior colliculus of the midbrain. Interthalamic adhesions. So this line which joins the anterior commissure and the posterior commissure is going to divide this into the thalamus superiorly and the hypothalamus inferiorly. We'll again talk about this later when we are going to talk about the hypothalamic anatomy. Above this we have the fornix, then we have the corpus callosum. So what happens is this slightly a more lateral section. So the habenular commissure ends more laterally as the habenula, which is located just posterior and slightly above the habenular commissure. So we saw the fimbriae of the hippocampus, we saw the fornix, we saw the mammillary body, we saw the habenular commissure, and we saw the habenular body. Last structure, which is more of a scarlet pimpernel, is the white matter which is going to surround the hippocampus roof. That is called the alveus. So in the other components, we have the alveus, mammillary body, habenular body, fornix, and fimbriae of the hippocampus. So we saw the limbic lobe, we saw the subcortical component. Now we are seeing the other components. Let's see it. There are three structures which are more important among this limbic system. One is the hippocampus, which has a group of structures associated with it, which is called the hippocampal formation. Hippocampal formation is basically hippocampus, dentate gyrus, entorhinal cortex, and subiculum. All this four things put together is going to be called as the hippocampal formation. So there's a slight difference between the hippocampus and the hippocampal formation. Let's see how the hippocampal formation looks in the gross anatomy. And what happens is, see, the hippocampus looks more like a seahorse, so or an S-shaped structure. The more anterior, inferior, and medial aspect, or the mouth of the hippocampus, is going to be the dentate gyrus. This is the dentate gyrus, green color structure. Then as you go from medial to lateral, this is basically the brainstem. So from medial to lateral, when you go, the numbering is actually the opposite, 4, 3, 2, 1. It is in the reverse manner. So that is the hippocampus. It is labeled CA because we already saw it can also be called as cornea ammonis. So CA 4, 3, 2, 1. Then you have the subiculum, which is the anterior part of the anterior or more S-shaped part of the hippocampal formation, which is also medial. Then once it takes the inferior turn, the most inferior aspect of the S is the parohippocampal gyrus. So entorhinal cortex is basically the uncus plus the anterior part of the parohippocampal gyrus. Subiculum. So somewhere here is the entorhinal cortex, which is a combination of the uncus and the anterior part of the parohippocampal gyrus. Moving on. Anatomy of the hypothalamus. So the hypothalamus basically has some around 10 to 20 nuclei, I think. Frankly, it is more of a visual hallucination from this point onwards. So let us identify the structures which are in the limbic system. The preoptic nucleus. Preoptic nucleus is the most anterior part of the nucleus, which is showed in orange color here, POA, which deals with sexual development. Moving a little bit posterior in the midline, what we are able to see is the ventromedial nucleus and the dorsomedial nucleus, which is on either side of the CSF, third part of the third ventricle, which deals with sex, satiety, and fear. As we move more laterally and posteriorly, we have the lateral hypothalamic area, LHA, which is more lateral. Also, it is more posterior, which deals with feeding impulse. So these four nucleus, namely the preoptic nucleus, ventromedial nucleus, dorsomedial nucleus, and the lateral nucleus, are the nuclei of the hypothalamus, which deals with the which are components of the limbic system. Anatomy of the thalamus. Anatomy of the thalamus also has multiple nuclei in it. It is basically divided into an anterior part of the nuclei. There is a huge lateral nuclei. There is a smaller medial nuclei. Then there is a median nuclei, which is basically the interthalamic adhesions and pars intermedia. And then there is the internal medullary laminae, which again has an anterior group and posterior group. So the out of all those nuclei, the lateral nuclei are more important because pulvinar is one of the important structures in the thalamus, which we'll be seeing in various pathological processes of the brain. So the pulvinar is the most posterior and lateral part of the thalamus. More posterior to it, we have the medial geniculate body and the lateral geniculate body. Let's see how these things look in MRI later, actually. As of now, we'll look at the gross anatomy of how these things are oriented to each other so that it becomes easier for us when we look at the MRI anatomy. So moving on to the next segment, this is going to deal with the MRI anatomy. As of now, we saw the gross anatomy of the limbic system and the various structures in it. So now we'll try to identify the 40, 50 odd structures of the limbic system and how they look in MRI. So limbic lobe, we saw 7 systems. Subcortical, we saw 5. Other components, there were numerous, 5 to 10. So limbic lobe, now we are not going to see it exactly as limbic lobe, subcortical and other components. It will be a mixture of it because all these anatomical structures are close to each other. So first let's see these four structures together, which is like easy to remember. Namely the cingulate gyrus. Cingulate gyrus is just above the cingulate lobe, which is identified in the what color is this? I think gray, yellow and green combination is seen. So this is the cingulate gyrus. And as you give more anteriorly, just inferior to the rostrum of the corpus callosum and anterior to the mammillary body, what we see is the subcallosal gyrus. So that plays a part in depression again. And orbitofrontal cortex and gyri recti. So the most superior frontal cortex, middle and inferior frontal cortex, anterior part of the frontal lobe, these parts. So the medial part of it is the recti gyri or gyri rectus, and the lateral part of it is called the orbitofrontal cortex, which most commonly gets affected in case of RTA, road traffic accidents. Just see what are the things which gets affected in it. It is basically the smell memories. Smell memories gets affected in case of a orbitofrontal cortex. Insular cortex, we know this very well actually. This is something which we commonly keep reporting and saying. This deals with addiction, craving, and desire. Moving on, MRI anatomy of the limbic system. So, if you see the temporal lobe, here the cortex and all is all very thin. As we go medially, you will be able to see a huge bulk of gray matter. Compare the gray matter here and compare the gray matter here. There is a bulk of gray matter here, which is basically the hippocampus. We'll see the detailed anatomy of hippocampus in the couple of slides. So it deals with long-term memories. So before moving further, there is an important orientation that we need to familiarize ourselves with. What is the relationship of the amygdala, hippocampus, and the parahippocampal cortex. So it is basically looking like a hamburger. So the middle layer is the patty, which is the hippocampus. Above it, what we are seeing is the amygdala, which is more anterior, and more posteriorly as we go is the parahippocampal cortex. The perirhinal cortex and the entorhinal cortex, these are basically parts of the parahippocampal cortex. We'll be seeing those later actually, which is actually separated by the rhinal sulcus. But as of now, we'll take this entire thing to be the parahippocampal cortex. So it looks like a hamburger in which the more anterior location is the amygdala, more in the middle is the hippocampus, and more posteriorly what we see is the parahippocampal cortex. Amygdala is in the most anterior location. See, now we have reached the level of the sphenoidal sinus. So here, whatever gray matter you are able to see is the amygdala, which deals with fear and anxiety. Parahippocampal cortex already we saw as communication. To complicate things further, there are multiple nuclei which are seen in the amygdala. If you don't have anything better, then you can remember this list of structures also. So now let us move on to how this looks in when we scroll it actually. So here we are able to see, let's see, this is the, let me stop this for a second. So we are going to move from anterior to posterior. Let me stop and explain. Yeah. This is the most anterior location. So this line, this cleft which you are able to see, right? That is the collateral sulcus. This is at the level of the sphenoidal sinus. This cleft which you are able to see is the collateral sulcus. How do you identify the collateral sulcus? It is at the 60-degree orientation. We'll be talking all this further anatomy in the left side of the body because it's easier to remember it. I'll explain to you why later. So this 60-degree orientation is going to be the collateral sulcus. This is going to divide your lobes into the fusiform gyrus, which is more lateral, and the parahippocampal gyrus, which is more medial. So whatever we are able to see green here is the parahippocampal gyrus. Whatever we are able to see red here is the collateral sulcus. How you are going to identify the collateral sulcus? By the 60-degree orientation. Let's scroll it a little bit posterior. Yeah. Now we'll stop at this and we'll see what is going on here. As you go more posteriorly, see the gray white matter. See this gray matter, this white matter, how thin these things are. So when it is in the temporal lobe, it is very thin. This is the last part in which we are able to see a clear white matter. Then after that, you are able to see a chunk of gray matter, which is seen here. You can compare that. There are lots of structures which is going on here by just comparing with the adjacent sulci and gyri. See the gyri here, it's very thin. Here it is thick because it's not just the parahippocampal gyrus which is stopping here. There is more structures which are added to the anatomy here, which is basically our amygdala. What did we see in the earlier slide? Amygdala is more anterior. Then we have the hippocampus. Then we have the parahippocampal gyrus. Already I told the parahippocampal gyrus also has the entorhinal cortex. Let's ignore that as of now. It is basically a patty. Amygdala, hippocampus and parahippocampal cortex. Parahippocampal cortex has two other structures. We'll ignore that as of now. So remember the hamburger. Hamburger has the hamburger, amygdala, and there is a parahippocampal gyrus, and then there is a collateral sulcus. Okay, so once you remember these, that the amygdala is in the more anterior. Still, we are at the level of the cavernous ICA. So this is the amygdala. So let's move a little bit posterior and see what's happening now. So again, amygdala. We are able to see the amygdala better. See, this is the entire amygdala. This is the parahippocampal gyrus. Scroll it a little bit posterior. Yeah, we'll stop it here actually. This is the starting of the next level of structures. So this is the amygdala. Then whatever we are able to see, we'll see this better in the next scroll. Will be the hippocampus, and more inferior layer of the patty is going to the inferior bred is going to be the parahippocampal gyrus. There is another small structure which is the dentate gyrus, which is shown in the dark green here. We'll look at that later actually. As of now, if you remember amygdala, hippocampus and parahippocampal gyrus with the collateral sulcus, that is more than sufficient right now. We'll keep on adding more structures later. It got away. Let's see. So now you are able to see the yes. This S is the most important thing. Okay, as you keep moving posteriorly, you start seeing the S kind of a structure. The top part is the amygdala. This is the hippocampus, and as you keep going inferiorly is the parahippocampal gyrus. Okay, this is amygdala, hippocampus, and the parahippocampal gyrus. Amygdala, then as you go, this is the hippocampus, and as you keep going inferiorly, it is the parahippocampal gyrus. This much is sufficient right now. See, can you see the S better? S-shaped structure. This actually also has an inferior tail. This is where the S is stopping, and there is a tail which is attached to the S actually. So I usually learn the anatomy on the left side because it's easier to remember that there is just an S, there is a collateral sulcus which is at 60°, and then there is a patty which is a part of the S actually. So this is the S shaped structure. So once you see the S, you can very confidently say this 4, 3, 2, and 1 of the hippocampus. And as you keep moving, which is the parahippocampal gyrus. Scroll up. So now we are able to add two more structures. This again colors lavender. This lavender color structure is the fornix. So as you move inferiorly, it is the mammillary body. So at this level where you start seeing the amygdala, you also start seeing the fornix and the mammillary body. We'll see this in the sagittal orientation. It's easier to identify that, but we need to familiarize ourselves with the coronal anatomy of the hippocampus and the mammillary body also. Let's scroll a little bit posteriorly. Again, now we are able to see the body and tail of the, which is shown more in an orange color, and we are also able to see the fornix. So that is the anatomy. So we keep scrolling again. Still we are able to see this is the body and tail of the hippocampus. This is the fornix which we are able to see. See, this is the body and tail which is going and joining the fornix. Okay, so the fornix of the limbic lobe is connected with the hippocampus. This is the coronal orientation of the same actually. So before you move on to the next slide, make sure that you have learned the basic anatomy which you have seen in this particular slide, because the next slide is going to be slightly more complicated. We are going to add more structures to our earlier lane structures. To identify the structures of the limbic lobe, basically we need to know our collateral sulcus. Then we need to know that there is a burger which is sitting there, which comprises of the amygdala, hippocampus, and the parahippocampal gyrus. Then we saw the various structures which are part of the S-shaped anatomy in the left part of the temporal lobe, limbic lobe. Moving on, uncus. Uncus is considered to be the home of the amygdala. So if you identify the amygdala and you surround it, amygdala is in the center. The uncus is the roof or covering of the amygdala. So that is the definition of uncus. Uncus is also called as the medial part of the anterior parahippocampal gyrus. So this is a collateral sulcus, this is a parahippocampal gyrus. So the medial and anterior most part of it is going to be the uncus. Hippocampus, parahippocampal gyrus, this is the amygdala. So this entire thing is going to be the uncus. Okay. So moving on further. Yeah. So this is an interesting slide which lots of structures which are going to add on to it. We'll start with the things that we are already familiar with, which is the collateral sulcus, which we saw earlier. Parahippocampal gyrus and the fusiform gyrus, both of them are divided by the collateral sulcus. Now let's see in the S-shaped structure. Okay, S-shaped structure, the mouth of it is going to be the, so see, we are going to start only from this part of the S. The superior part of the S is actually the amygdala, which has come more anteriorly, and now in this slide we are not able to see, because in this slide the amygdala is not seen because it's in the middle part or more posterior part of the coronal anatomy. So this is the part. So here if you see, this is the dentate gyrus. See this small thing, which is considered to be the mouth of the hippocampus, is the dentate gyrus. From there, as you keep going, S-shaped. This S-shape which we are able to see is a 4, 3, 2, and 1 of the hippocampus. This particular sulcus, you are able to see a sulcus here. That is the hippocampal sulcus. We'll again see this hippocampal sulcus later. This is going to be the cleft which is going to see in the inferior part of the S. That is the hippocampal sulcus. As you go inferiorly, The first turn is going to be the subiculum. Next turn is going to be the uncus. The third turn is going to be the parahippocampal gyrus. Subiculum, uncus, parahippocampal gyrus. Okay, all these three things are together. Now, what is the entorhinal cortex? Is basically part of the uncus and the anterior part of the parahippocampal gyrus. So, if you add these two structures together, it is going to be called as the entorhinal cortex. And the hippocampal formation is basically the hippocampus plus dentate gyrus, subiculum, and entorhinal cortex, which is the uncus and the anterior parahippocampal gyrus. I hope you have understood the difference between the hippocampus and the hippocampal formation and what are the various small structures which are there in the hippocampal formation. The CA1 is another important thing because see, in CA1 there are further layers, again hallucination to the next level. There is radiatum and lacunosum molecular. These are the two things which gets atrophied in case of Alzheimer's disease. So you will specifically look for atrophy of the CA1 part of the hippocampus. We'll take it to the next level now. So we already saw the collateral sulcus, which is divided at the temporal lobe into the fusiform gyrus and the parahippocampal gyrus. Okay, and then we saw this. So now see, now we have gone to the right side of the anatomy. We have been dealing with the left side of the anatomy. Now it's going to be a reverse S shaped in the right side. Dentate gyrus, 4321 of the hippocampus, subiculum, uncus, and the parahippocampal gyrus. Now if you see, there is a small cleft within the parahippocampal gyrus. This cleft is called the rhinal sulcus, which is going to divide the parahippocampal gyrus further into an entorhinal cortex medially and the perirhinal cortex laterally. Okay, so there is two more things. We saw the entorhinal cortex and perirhinal cortex that is divided by the rhinal sulcus. Again, this is going to be a scarlet pimpernel of the limbic system. We will see it actually in one of the slides. It was very clearly seen and convincingly seen. Actually, I'll show it when it comes later. But let us remember that rhinal sulcus is what divides up parahippocampal gyrus into the perirhinal cortex and the entorhinal cortex. And as you move superiorly, see here we are able to see the hippocampal sulcus. Convinced? Collateral sulcus, hippocampal sulcus. So this hippocampal sulcus is going to be the place where you are going to search for the dentate gyrus. This is the dentate gyrus. It's basically like a yin yang sign, right? An yin yang sign of the thing. So this is again very in a 7 Tesla MRI. This can be very clearly seen. But if you are asked to locate the dentate gyrus, this is where you are going to look for it. Okay, and then further as you go up superiorly, the ambient system, this is the ambient system, this is basically pons and midbrain, so this is the ambient system. The ambient system is going to open into the lateral ventricle temporal horn through the choroid fissure. So this is the ambient system, this is the lateral ventricle temporal horn, choroid fissure is going to be somewhere here. We'll see it later actually. What else is the, so basically in this slide we have added two more structures, the rhinal sulcus, which is dividing the perirhinal cortex and the entorhinal cortex, and there is a choroid fissure which is going to communicate within the ambient system and the lateral ventricle, apart from the two other sulcus which we already learned, hippocampal sulcus and collateral sulcus. First we learned these two sulcus, now to those two sulci we are adding the rhinal sulcus and the choroidal fissure. Ambient system is the system that we are able to see here. So we'll move further. See in the slide, let's see what is going to happen. So hippocampus we saw has a head, body and tail. It is best seen in the axial anatomy. So whatever part of the hippocampus which is anterior to the midbrain is called the head. Within the midbrain area is going to be called as the body of the hippocampus, and what is posterior to the midbrain anatomy is going to be called as the tail of the hippocampus. So the delineation between the head, body and tail of the hippocampus is better seen in the axial anatomy. And now we'll see a couple of more structures here. See, this one is going to be the fimbriae. Fimbriae is basically this small hook-like structure which we are able to see. This is the fimbriae. Fimbriae. Two is going to be the dentate gyrus. So this is the dentate gyrus. This is the starting point. So if you put an ink pen, you remember the good olden days where you start a point and ink gets absorbed. So the starting point of the hippocampus is going to be the dentate gyrus. Then it is going to go into the remaining thing, cornea amnis and the subiculum, the uncus, parahippocampal gyrus, collateral sulcus. 8 is going to be the temporal horn of the lateral ventricle. Okay. So let's see this is a fimbriae, this is the optic tract, and this is the choroid fissure. We saw the choroid fissure earlier, right? So this is a choroid fissure which is going to communicate between the ambient cistern and the temporal horn of the lateral ventricle. So this is important because we will be talking about choroid fissure cyst later. So this is where we will have to look for it in the coronal anatomy. So this is a 7 Tesla MRI. So just to demonstrate that there is really something called alveus, I took this slide. So here we are able to see this white matter which is going to cover the hippocampus is going to be called the alveus. Remaining anatomy also are better seen. The hippocampal sulcus 4321, dentate gyrus which is here, subiculum, uncus, entorhinal area which is basically uncus and the anterior part of the parahippocampal gyrus, collateral sulcus, fusiform gyri. Yeah, and that is pretty much everything in the right side of the temporal lobe. So to summarize, we already saw the hippocampal formation is basically the hippocampus plus dentate gyrus, subiculum, and entorhinal area. So it is entorhinal, not entro. So all these four things put together is going to be called the hippocampal formation. Medial temporal lobe is basically our patty, the burger, hamburger, amygdala, hippocampus, and parahippocampal gyrus with the uncus and dentate gyrus. So when we report a medial temporal lobe or the mesial temporal lobe is showing flat hyperintensities, basically we are saying these five structures are showing hyperintensities. So our hamburger plus our uncus and dentate gyrus put together is going to be called the mesial or medial temporal lobe. Moving further, the small components, the subcortical component, septal nuclei, where exactly it is, it's going to deal with pleasure. It is basically the fornix and the corpus callosum. This is the septum, this is the septum pellucidum, right? Where both of them are meeting together just above the level of the fornix. See, just above the level of fornix, whatever you see is the septal nuclei. Olfactory bulb, which deals with smell emotions, are very easily identified. You see, basically see the cribriform plate of ethmoid, the CSS space. These two black structures which we are able to see is the olfactory bulb. Moving on to the habenular body and alveus. Alveus we saw earlier. So this is the alveus, this is a choroidal flexure. Remaining things are nearly the same, which we already saw in the hippocampal formation. We'll talk about how the habenula looks. We saw the habenular commissure and we started tracing it slightly laterally in the sagittal anatomy. Coronal anatomy, how it looks is basically we go very posteriorly. This is splenium of the corpus callosum and we see part of the fornix. This is the third ventricle and this is the posterior part of the thalamus. Here, whatever structure, this white structure, small nodule, which we are able to see is the habenula, which is just above the posterior commissure. The posterior commissure and the habenular commissure together constituted the germinating seed appearance of the mid-sagittal anatomy. In the mid-sagittal anatomy, we tried to identify two structures, namely the W structure anteriorly and the germinating structure posteriorly. The germinating structure superiorly for the habenular commissure, which went and ended in the habenula, which is well seen in this coronal anatomy. That's slightly parasagittal. Okay, so it is in the coronal view that you'll be able to see the habenula. Habenular commissure is better seen in the sagittal anatomy. Okay, we'll move on to the next thing. So we saw a hamburger, we saw a shaped, we saw a 60-degree anatomy, we saw a germinating seed, we saw a W shape. With the list, we are going to add a hair clip. This is what she always wears, my daughter. So basically, it has two small hubs, and then there is a huge thing which sets a hair straight actually. So similar kind of an appearance is seen in the brain also. So mammillary body, this is the body of the fornix, which looks like the hairband or a hair clip, whatever it is called, hairband, and it ends in the hippocampus. So this is how it looks in the gross anatomy. The fornix has an anterior column, it has a body, and it has a crura. We'll look at these structures later in the coronal anatomy. Okay, mammillary body, fornix, and it ends in the fimbria of the hippocampus. The fimbria of the hippocampus and the mammillary bodies are the two knobs or stubs of the ends of the fornix. So we'll have an in-depth anatomy of the fornix. So we already saw this has been divided at the more anterior column. So this is the anterior column. Basically, it looks like a vertical structure. So it is called the anterior column of the fornix, which is better seen in the coronal anatomy. As you go more posteriorly at the level of the internal cerebral vein, this round color structure is going to be the body of the fornix. As you go even more posteriorly, it is going to diverge again into two separate structures, which is going to be the crura of the fornix. which is going to basically end in the fimbrium of the hippocampus or the hippocampus. So we'll end the discussion with the hypothalamus and the thalamic anatomy. Hypothalamus itself is a huge anatomy of its own. Again, we'll go back to our famous W, which is anterior. Anterior commissure, lamina terminalis, optic chiasma. This is the infundibular stalk, pituitary gland, tuber cinereum, mammillary body, and it goes and ends in the posterior commissure. So this imaginary line is going to divide the mid-sagittal anatomy into thalamus superiorly and the hypothalamus inferiorly. Same thing is seen in the T1 anatomy. Mammillary body, tuber cinereum, infundibular stalk, optic chiasma, median eminence, lamina terminalis, anterior commissure. Pineal gland, posterior commissure, hamnular commissure. Easy? Very good. Yeah. Now we need to open our eyes even further and start imagining things to the next level. So this is basically the hypothalamus in the coronal anatomy. We already saw only like four nuclei, right? We saw the dorsomedial nucleus, the medial preoptic nucleus, the dorsomedial nucleus, the lateral nucleus, and the ventromedial nucleus. These are four nuclei of the hypothalamus. There are n number of nuclei. We are not going to bother ourselves with that today. Not today is going to be the thing for today. We'll concentrate only on the four things. So to understand these four things also, we need to divide the hypothalamus at three levels. One is at the level of the optic chiasma. So go into the coronal anatomy. When you reach the optic chiasma, stop. At this level, you will also see the anterior commissure. So the most medial part of the hypothalamus here is going to be the MPO and LPO, which is basically the medial preoptic nucleus and the lateral preoptic nucleus. Okay, so this is the MPO and LPO, which is the preoptic nucleus. Go a little bit posteriorly. Here you are able to see the pituitary stalk, right? That is the mid-sagittal section of the hypothalamus, or this is where the medial eminence is located. At this point, you will be able to see the ventromedial nucleus and the dorsomedial nucleus. This is the second set of nuclei which is seen in the hypothalamus, which is part of the limbic system. We are basically dealing with limbic system, not with hypothalamus per se. So these are the two important nuclei which is seen in the hypothalamus. Go more posteriorly, this is at the level of the mammillary body. At the mammillary body, what you are able to see is the lateral nucleus. So leave the medial portion and circle something laterally, that is going to be a lateral nucleus. So the hypothalamus has further three components, which is the optic chiasmal part, the median eminence component, which is in the middle part, and the mammillary body component, which is more posteriorly, at which levels we see the preoptic nucleus, dorsomedial and ventromedial nucleus, and the lateral nucleus respectively. Again, same thing, anterior, tuberal, and the posterior component. So preoptic nucleus is going to deal with sexual development. The ventromedial and dorsomedial nucleus is going to deal with sex, anxiety, and fear. Lateral nucleus is going to deal with feeding impulse. Yeah, even complicated further, there is going to be an MRI anatomy of thalamus, in which we are going to see only. And please don't bother learning the number of nuclei. I think around some 20 to 30 color shaded structures are 29 actually. This is Moral Settlers. They told it's around 29 structures are there. We'll stick on to our famous pulvinar, medial geniculate and lateral geniculate body, which is actually commonly seen in many of the pathologies actually. So medial is music, lateral is the optic radiation. So let's learn at least these three structures which are more posterior, the orientation of which we'll try to identify the internal medullary lamina. At least we can show ourselves that this is a medial nucleus, this is an antenucleus, and this is a lateral nucleus by basically identifying the internal medullary lamina. Let's see how it looks. This is the 20 moral 29 right thalamus, all the structures together. So wonderful depiction of all the nucleus, the anterior, the medial, posterior and lateral. The medial here, they are further divided into the intralaminar and midline nuclei, pulvinar, medial geniculate nuclei, lateral geniculate nuclei. You can pause and stare or look at it for a couple of minutes if you're really interested in knowing the various nuclei of the thalamus. I prefer to move on. So this is from Harry Potter, where Harry Potter keeps looking at the dog in the sky. So with the fair warning has been given of what you're going to expect in the next couple of slides. So this is the T2 weighted, heavily T2 weighted anatomy. Normally we don't see the thalamus so bright. In fact, if you see it like so bright like this, you are going to label it as a pathology. So in this, I took this particular slide because you are able to see this white color structure, right? That is the intermedullary lamina. So that's going to divide it into the medial, anterior, and the more lateral part of the thalami. So pause it, and this is the pulvinar. So you can identify the pulvinar very clearly. So if you identify the intermedullary lamina, more posterior and lateral to this is going to be the pulvinar, and the remaining nuclei, medial, dorsal, ventral, anterior, ventral, lateral, ventral, posterior, ventral, posterior, lateral, whichever six directions are there, you can name it. Out of which the anterior nucleus and the dorsomedial nucleus, the anterior nucleus and the dorsomedial nucleus of the thalamus. See, all these are basically the medial part of the thalamus or medial part of the hypothalamus, which is going to be components of the limbic system. How do we identify the pulvinar? We saw it in the axial. In coronal, let's identify how the lateral geniculate nucleus and medial geniculate nucleus looks. So first we have to go into the coronal anatomy at the level of the superior colliculus. Here, if you see coming superiorly, you will be able to see it's two dips, two bulges, two nodules. This is the first nodule, which is basically the medial geniculate nucleus. As you move more laterally, you are able to see another thing, which is the lateral geniculate nucleus. Or the other way of looking at this, in the hippocampal formation when we are discussing, we saw there was the optic radiation. You keep tracing that posteriorly, you will end up with the lateral geniculate nucleus. Superior colliculus, lateral geniculate, medial geniculate nucleus, and lateral geniculate nucleus. So superior colliculus is a key to identifying these two structures. From there, you go laterally and see these two bumps, you will be able to identify the MGN and the LGN. So coming to the conclusion of it, what is the difference between Papez circuit and limbic system? The first time when Papez circuit was identified a couple of decades earlier, it was first described as a cingulate gyrus, anterior part of the thalamus, mammillary bodies, and hippocampus. But now our understanding of the limbic system has become more extensive and exhaustive, with many people doing more researches and bringing out new anatomical structures. So our anatomy is also growing, and we are forced to identify more structures in our anatomy, which is listed here, which has a limbic structure is basically an extended version of the Papez circuit. Now we no more call it as Papez circuit, we call it as the limbic structural anatomy. So the cingulate gyrus, corpus callosum, there is the indicium griseum, which is between the corpus callosum and the cingulate gyrus, which goes and ends in the fimbria of the hippocampus, parahippocampal gyrus, amygdala. This is basically the hamburger. Then there is a hypothalamus, mammillary body, optic chiasma, antecommissure, posterior habenullar nuclei, thalamus, optic bulb, everything. So again, you can pause it and look at it if you're really interested in it. So these are the 50 odd structures we were discussing the last 40 minutes. So I've identified, see, many of those things are put in brackets because they are now not actually part of the limbic system. But without identifying the collateral sulcus and the fusiform gyrus, you will never be able to identify the parahippocampal gyrus. Right? We started our discussion with cingulate gyrus, subcallosal gyrus, orbitofrontal cortex, and insular cortex, which is basically the parts of the frontal lobe in the mid-sagittal section, which was easier to identify. Then what did we do? We went into the collateral sulcus, which divided it into the fusiform gyrus and the parahippocampal gyrus. And whatever is in the brackets are not basically parts of the limbic system, but without which we can't identify. So with the parahippocampal gyrus, we started identifying the amygdala and the hippocampus, which was basically a hamburger. Then we saw the S shape, which was the dentate gyrus, subiculum, uncus, entorhinal cortex, and perirhinal cortex, and the rhinal sulcus, hippocampal sulcus, and choroidal fissure. I told I'll show you the rhinal sulcus. I'll just go back to my earlier slides and to see where it is. Then we saw the head, body, and tail of the hippocampal sulcus, which was seen in the axial anatomy. Alveus, the scarlet pimpernel of the hippocampal formation, mesial temporal lobe and hippocampal formation. What are the 5 and 4 structures which are part of it? The septal nucleus and the olfactory bulb. Then we identified pineal body and the germinating kind of an appearance, which resulted in the posterior commissure, habenula commissure, and habenula laterally. Mammillary body, fornix, and fimbria of the hippocampus, which was basically looking like a girl's headband. Then there was a W-shaped structure, which was antecommissure and linea terminalis, optic chiasma, median eminence, pituitary tract, and tuber cinerea. Then there was hallucination to the next level, in which we saw the medial preoptic nucleus, lateral preoptic nucleus, dorsomedial nucleus, ventromedial nucleus, lateral nucleus. Then there was the thalamus, in which at least we were able to see the intermedullary lamina, which divided into the anterior, medial, and lateral nuclei. So I hope I didn't end by confusing you. So thank you for listening to it. Let me just see whether I can go back to the earlier slide. Thank you. So we have come to that earlier slide, the 7 Tesla MRI for identifying the alias. That slide, if you go back and see, this is a parahippocampal gyrus. This is a parahippocampal gyrus. We wanted to see the hippocampal sulcus actually. This is the hippocampal sulcus. This is a parahippocampal sulcus. Yeah, this is a parahippocampal sulcus, which is going to divide into the entorhinal cortex and the perirhinal cortex, which is divided by the small sulcus. Okay. So to identify these structures, we'll have to go a little bit systematically because there are like 40 to 50 odd structures which are seen in the limbic system. Start with the collateral sulcus. That is going to divide your parahippocampus gyrus from your fusiform gyrus. Then go into, once you identify the parahippocampal gyrus, remember the hamburger. Hamburger had the amygdala, hippocampus, and parahippocampal gyrus. So from there, you're going to make the S shape. And once you're familiar with the S, add a tail onto that S, which is basically your amygdala, hippocampus. This is the dentate gyrus. And then as you turn inferiorly, it is going to be the subiculum in uncus, entorhinal cortex, and parahippocampal gyrus. Then we saw the headband, which is basically the fornix, fimbria of the hippocampus, and the mammillary body. Then we saw these two structures. Anteriorly, we had the W-shaped part of the hypothalamus, which is basically the optic chiasma, anterior commissure, linea terminalis, optic chiasma, median eminence, infundibulus stalk, pituitary gland, tuber cinereum, and the mammillary body. Then posteriorly, we saw the germinating seed appearance, which had the pituitary gland, posterior commissure, and habenullar commissure. Thank you.